Alrighty, well, welcome everyone. Thanks for taking a little bit of time out of your day to join us to learn a little bit more about the Region 5 Public Health Leadership Institute. So in the short time that we have together, we're going to be sharing a lot of information, and we will also have a little bit of time at the end for some questions and answering any curiosities or anything else that comes up. So really just jumping right in, I'd like to start with a little bit of background about the Region 5 Public Health Training Center and collectively our Public Health Training Center network. So all of the public health training centers are funded by HRSA, the Health Resources and Services Administration, and collectively we represent the nation's most comprehensive resource for public health workforce development. Collectively, we aim to strengthen the skills of the current and future public health workforce, but the way in which we approach that within our respective regions is really tailored to meet the needs of those in our region. So what we do as a network and individually in Region 5 is we provide access to professional development, experiential learning, consulting, and technical assistance. Our work is divided into three main areas. So we offer professional development resources to help public health practitioners build and strengthen the competencies that are needed to address current and emerging challenges. We also offer trainings that are often free and low cost CE credit as well. And we provide experiential learning to students, the future of our workforce, through funded field placements at agencies in underserved communities. And lastly, we provide access to expertise and other resources to help our partners on the ground better understand and plan for local workforce development needs. So drilling down a little bit more into the Region 5 Public Health Training Center, we have amazing partners, training and technical assistance partners across our region, representing a variety of organizations. We have some academic units, schools of public health. We have local and state health department partners. We have some public health and primary care association partners as well. And we have a national level organization, the National Network for Public Health Institutes. We actually are fortunate to have a few members of our partners here today, and those that are bolded on this list on that bottom 2/3 or so are members of our Leadership Institute Planning Committee. So at this time, I'd like to invite Debbie Adapolo from the Michigan Primary Care Association and Goody Kapadia from the University of Illinois, Chicago, to just jump in and share a little bit about yourselves and your role in working with us, especially with our Leadership Institute.
Well, I'll start. Hi, I'm Debbie Adapolo, and I am the Senior Director of Health Equity with Michigan Primary Care Association. And I am a retired public health person, and I have been partnering with U of M, the Public Health Training Center this is going on our third year. That's exciting. And it's been a learning experience for me as well. And so I am happy to be here.
Good morning, everyone. My name is Goody Kapadia, and I'm an assistant director here at the University of Illinois Chicago School of Public Health. My goal is to be a retired public health person, so thank you for giving me that aspiration there. But I have been at the School of Public Health and working with the training center since the inception of the HRSA Training Center. So we're going on a couple of decades, and University of Michigan has been a partner of ours. Also going on a couple of decades, I feel like. So we truly believe in the work that this training center does and the regional training centers across the country. So.
Great, thank you so much, Debbie and Goody. And like I said, really happy to have you with us today. You might be helping me answer some questions at the end, so thanks for joining. So with that, I'm going to jump into an overview of our Leadership Institute, which we often abbreviate as RVPHLI. So you'll probably hear me use that acronym, that abbreviation, as we move forward. So for RVPHLI, our overarching goal for this program is really to set a foundation, whether somebody is a current leader or they're an emerging leader. We want to help strengthen skills, to recruit and retain a diverse workforce, to engage cross-sector partners in addressing social determinants of health, and really to help these current and emerging leaders be nimble in the face of constantly changing circumstances. We're hopeful that by the end of the program, folks will be able to achieve these three main objectives: to be able to practice adaptive leadership skills to guide change at the organizational, community, and systems level, to identify approaches for creating a culture of learning within their agencies, and also to apply strategies to foster a supportive workforce culture for diverse workforce in their agencies. Alrighty, and so I'm going to go to our next slide here, talking about intended audience. So it's really our priority to engage a cohort of folks that are diverse in a lot of different ways, professionally and personally. We really strongly encourage participants in applications from people of color and underrepresented groups, folks that are working in rural communities, medically underserved communities, and also those coming from a range of disciplines within public health and primary care. One thing that I will focus on a couple of times here, especially as I'm going through some of the requirements and who we're really focusing on, is that there are no degree requirements to participate in our program. The program is intended for folks that are already working in governmental public health or governmental primary care. So we're really seeking to include folks that are at that mid-career level. They have at least 5 years of work experience in their respective field, but they don't need to have any formal leadership experience or have leader, manager, or supervisor in their title. We hope that folks in the program are involved in some way in workforce development, community health strategy, and/or performance management. If they're in a managerial position, great, but also we have participants that are in administrative, program, or clinical positions as well. Folks do need to be working within governmental public health or primary care. So on the public health side, that looks like working in a state, local, or tribal health department within Region 5. And on the primary care side, that looks like working at a federally qualified health center or a lookalike. And ideally, our participants are serving in a medically underserved community, a rural area, a health professional shortages area, or another identified high need area. We often refer back to the Social Vulnerability Index, but in the application process, there are other opportunities to kind of share about the area and community that you're serving in. Okay, let me click one more time here. So as I've mentioned a little bit, and we really want to make sure this is clear for folks, the program is only available to individuals that are working within the Region 5 states. So those states include Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. The cohort is limited to 38 people across our 6-state region, and the breakdown of that looks like roughly 6 to 7 people per state. So 6 people per state times 6, that's 36. On top of that, we also reserve 2 spots for folks working in tribal health organizations as well. We encourage participants to apply as individuals. However, we also encourage representatives from both of our fields that we're serving, public health and primary care, in the same community to apply to the same cohort as it makes sense to. We do have our call for applications live. It just opened a couple of days ago. It's open the entire month of October, and it will be closing at the end of this month on Thursday, October 31st, 2024 at 11:59 p.m. Eastern. Okay, so here, just going to pause. I've been talking, I think, nonstop for a couple of minutes here. So just want to learn a little bit more from everyone that is on the call with us today. I'm going to launch a couple of polls that you should see on your screen, and essentially want to know which Region 5 state are you working in. You see the response options on the slide there: Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. And then also you should at the same time be able to answer the second question. How long have you been in a leadership position, whether that's in title or not? So for those options we have, I'm not currently in a managerial or leadership role, but I'm interested in pursuing one. And then some other time breakdowns: 0 to 1 years, 2 to 4 years, 5 to 7 years, and 8+ years. Okay. So looking on my end, it looks like everyone has answered the poll. Great. And now I'm going to share the results. So in Region 5 states on our call today, it looks like we have just over half of our participants from Ohio, one person from Wisconsin, 4 from Michigan. Okay, so maybe some of the other folks from other states weren't able to make the call today, and that's all right. They'll be able to catch the recording. And for our second question, how long have you been in a leadership position, whether in title or not? One person is not currently in that role, but looking to pursue one. 2 folks are 0 to 1 years. 5, so the majority of people here have been in a leadership role 2 to 4 years. 1 person, 5 to 7, 2 people, 8 plus. So there's a variety of experience here, and that's great. That's really what we aim to have in our cohort as well. So that's really helpful for us to see folks that are interested in our leadership program. Okay, so I'm going to go on to our next slide here. So in terms of our applicant review and selection process, we really like to be transparent with everyone that's applying so they know what to expect. On our end, after the application closes on the end of October 31st, right on November 1st, our team is going to start the initial screening step. So we have a set of criteria listed in the description of our intended audience that we just went over. We also have those criteria in a rubric that is posted on our website in case you'd like to look at that with a little bit more time and detail. So after our team does an initial screening for eligibility, then we have members of our review committee do a really in-depth review. So for each state, 2 people will use that rubric to review each application, and then they will make recommendations as to whether they accept, want to put someone on a wait list, or decline. Then those 2 individuals are going to meet, they're going to convene and make some selection decisions, and based on those selections, they'll share that back with us, and then in early December, we will be sending out notifications to everyone that has applied. All right. So I know there's a lot of text here, but we're going to go through all of these points just to make sure that we're providing a little bit more information about what are the kind of meat and potatoes, what does the program consist of. So our Leadership Institute, RVPHLI, is a 6-month cohort-based program. It runs from January to June of 2025. We'll have 3 sessions in January. Really want to kind of front load the beginning, so we have time to build some rapport and relationships amongst the cohort, amongst ourselves. And then starting in February, we will have sessions every other week. Sessions will go through early June. All sessions are going to occur on Thursdays from 10 a.m. to 12 p.m. Eastern. And in total, we'll have 13 of those 2-hour live sessions. Each of those sessions has a didactic portion. There's also interactive exercises. We'll be exploring case studies, reviewing examples, create space and opportunities for peer discussion. And all of those sessions are recorded so that if you're absent, if you're in the cohort and you're absent, you can still catch the content later on. In between sessions, we have some independent study. So folks are able to do some pre or post work, reflective journaling, discussion prompts. And additionally, we have integrated 3 reflective coaching sessions during the off weeks. So this year we're increasing both the number of coaching sessions we're offering and the duration of the coaching sessions. And that's based on feedback from our cohort last year. So this year we have 3 90-minute coaching sessions where participants will be able to work in small groups within their state and even subdivided into smaller groups within their state. They'll be working with coaches on real world challenges that they're facing in their workplace and in their community. And overall, the time commitment that we're aiming for is to keep the program within 40 contact hours. So that breaks down to about 1 to 2 hours per week. And one thing to mention, we have received some questions about this in the past. Is there a project component of the program? No, there is no individual or team project as a part of the curriculum. Our goal was to design a program that would balance having enough contact hours and types of content to be meaningful, while also recognizing the limited free time of our intended audience. our folks that are part of the cohort are really busy, and we just wanted to make sure that we weren't burdening them with additional project work. So all of the dates for those 13 live sessions and the 3 coaching sessions are listed on our website, and we'll be sure to share a link to that page in the chat in a little bit. Okay, so this is our last very text-heavy slide, I promise. So in terms of the curriculum as a whole, we have the program divided into 3 thematic chunks. So in part 1, we are really setting the stage with adaptive leadership. What is adaptive leadership? What does that mean? Adaptive leadership is, in a nutshell, one leadership style or one leadership framework or theory that is based off of Ronald Heifetz and Marty Linsky. They are leadership experts, Harvard professors, and I guess the simplest way I like to think about it is adaptive leadership allows and enables folks to address challenges, to not just address challenges and find a quick resolution, but to really go deeper, to learn how to anticipate challenges and also figure out what are the root causes of those challenges. So you're not just putting a Band-Aid on top of a more dire wound, if that makes sense. So in the first part of the curriculum, we're focusing on sharing and understanding adaptive leadership while also rapport building, making sure that we're strengthening connections among our peers in our cohort. In part 2, we're zooming out to the systems level. So we're focusing on adaptive leadership for systems level change. And then in part 3, we are focusing on organizational change. So we're zooming in just a little bit and thinking about how are all these things that we've learned so far, adaptive leadership at the individual, interpersonal, and systems level, how are all of those different tools and pieces of information that we've learned actually adaptable and applicable in our organizational setting. So here you can see the numbering is hopefully not too confusing, but we have 5 sessions in part 1, 5 sessions in part 2, and then 3 of those live sessions in part 3, for a total of 13. Okay, so we've been sharing a lot of information about our Leadership Institute, but what's the value add? Why should someone apply and participate in RVPHLI? Well, we feel like it's an opportunity not just for current leaders, but also for emerging leaders to be able to learn together, to share with their peers, and to expand upon their existing strengths and abilities. Being able to work with others, to share ideas, to problem solve, to work through challenges, to help address issues that they're facing, not just at their organization, but also beyond that in the community and hopefully at the systems level as well. The benefit to supervisors and agencies. Our program, if I haven't mentioned already, is no cost. It's entirely free. It's entirely virtual as well. So it's very accessible for folks. And we're hopeful that it's able to provide not just some professional development, but doing it in maybe a non-traditional way, allowing folks to have some alternative creative experiences and opportunities to reflect and explore on their own individual leadership styles, to learn about new theoretical principles, to get to practice some of those things that they're learning, and to do it in a shared learning environment with peers across our region. So that's something that is free, that's easily accessible, that an agency doesn't have to pay for. So that's, I think, a great value out of our program. One thing I would like to note before we segue into our Q&A portion is that our program, RVPHLI, is not approved, it's not pre-approved for continuing education credits. However, at the end of the program, we do issue out certificates of completion to all participants that complete at least 80% of the required activities. So after the program, those folks have the opportunity to submit their certificate to their own licensing body to see if they're able to get continuing education credits. But at this time, we are not offering pre-approved CE. And participants also do have an opportunity at the end to stay connected to alumni from their cohort and also with others that are now part of our growing body of alumni. So And I think with that, we will move into our question and answer portion. Going to see if there are any things coming in the chat. And if not, that's okay. It might take some time for people to process all the information that we just threw your way. I do have some questions that I know I've been hearing from others. I've been getting different emails, and anytime I talk about this, been talking about this with a lot of people lately, there are some questions that have been coming up that I think are helpful to talk through. So someone was asking me, like, okay, there's all this information that we're going to learn, but what are some expected outcomes that we could anticipate? So I think for one, definitely having an increased awareness of leadership frameworks. Not obviously we're focusing primarily on adaptive leadership, but we might touch on some others as well. And folks are going to have a better understanding of their own personal leadership skills, so their strengths and weaknesses. That's primarily due to a leadership self-assessment that we're able to issue to participants in the beginning. So that way, from the beginning, you already have a sense of what your strengths are, what are your weaknesses, things to look forward to trying to work on. And then also as a whole, we look at those strengths and weaknesses of the cohort to see where we might be able to leverage some of those strengths across our network. Alrighty, I see something coming in the chat here. If we already know we will not be able to attend at least 3 live sessions, would you invite us to still apply or wait until next year? That's a really good question. Thanks for asking that. I would say if you know you cannot attend, around 2 to 3 sessions, I would say still go ahead and apply. You never know if things may change. Ideally, we would like for participants to attend at least 10 of the 13 sessions. That is one of the requirements in order to work towards earning that certificate of completion. However, there are often, well, not often, there are always opportunities to make up that work if you miss a session. And usually towards the end, there are some bonus activities that we issue out to participants in order to make up if they, miss too many live sessions or they miss some other required component. So yes, I would say if you're interested and you feel like you can attend all the other sessions, that I would encourage you to still apply. Yeah. Okay. Another question that had come up is, how do we measure impact? Like, how are we looking to see if we're being successful, or even just getting a sense of things that we need to change on the fly? I will say that we do a lot of evaluations. So we issue out some program evaluations, pre, midpoint, and post. And then also after every session, we issue a short survey. So that way we're getting real-time feedback from our participants about what things we need to tweak before the next session. But we don't just issue that to our participants, we issue it to our partners as well. So Goody and Debbie, who are here with us, they've taken those post-session surveys to give us feedback in real time so that we can be responsive and make those quality improvements throughout. Okay, well, I'll pause for a minute and see if there are other things coming in. And also just see, Debbie and Goody, if there's anything else that you'd like to share, uplift from our program, from RVPHLI.
I know Goody's internet was giving her some trouble, so I think we might have lost her just now.
Okay.
So one of the things for me that I think that has been really helpful since COVID, there's always public health hasn't been the same, nor has primary care. And so there's this training really has provided some additional information to support this sort of new era that we are in, particularly when we start thinking about an adaptive leadership. And so I think it is a great opportunity to upskill, if you will, to get some new information that can help to support folks in their endeavors to support their public health departments or their primary care clinics or offices in this new era that we in, this post-COVID era that we are in.
Yeah, thanks, Debbie.
Apologies, technical difficulties on my
It's
end.
all right.
But Uh, I I also echo what Debbie says. I will share that I know when we have been doing a lot of conversations with our local health department and partners, the connections have been lost through the pandemic. And so, as you mentioned, Donnie, the cohort of learners, not just the ones that you will be learning with, but the past learners really is a benefit to all, I think. And so it's really an opportunity to create some peer-to-peer, you know, growth. And I think it's just a nice way. And we know that you know, public health crosses borders, so it's nice to also have that dialogue with all of the states, um, surrounding states that you're working with. So
Yep, thank you both. And that actually like segues into one of the last points I wanted to make. It was perfect setup. Thank you both. Yeah, I think being able to bring folks from both fields together is so important. We saw that during COVID, working in silos wasn't working. So by bringing folks together, we're able to have some candid, hard honesty about what are the existing challenges and barriers that we're working through, but then also being able to collaboratively problem solve, to think creatively, to think from an adaptive leadership perspective, how can we address this in a different way? How can we leverage our strengths and our networks, right? And I'm going to put another plug. It's completely free and virtual as well. So I don't think you can get any better than free. So I think with that, I'm not seeing anything else in the chat. Thank you, Phoebe, for putting that link in there. And I'll also just put our email address in case any other questions pop up. But with that, we'll go ahead and wrap up. Stay tuned in the coming days. We will have this recording up on the website, as well as a static copy, a sample of the application, the rubric, an FAQ doc, and the slides from today's info call. So I think with that, we'll give everybody a couple minutes back. Thank you all so much for joining today.